Okay, what a phenomenal day. So good afternoon, everyone. And thanks for hanging in there for our last talk. We have certainly saved the best for last. My name is Erica Goldstein, and I have the pleasure as serving as moderator for our next session. And I am a fourth year student within the Exercise Physiology Ph.D. program at the University of Central Florida. And I'm under the mentorship of Dr. Jeffrey Stout. My research and clinical interest is in the area of sports nutrition and special populations with a focus on master's class and female athletes. I hope that you will join our networking social immediately following Dr. Smith-Ryan's talk. If you are on social media, please tweet or post along during this lecture using the hashtag IEPRS21. If you have any questions during this presentation, please ask them in the chat and I will do my best to address them. Finally, I want to again thank all of our sponsors for their generous support of our event. It is now my absolute honor to introduce our next speaker, Dr. Abbie Smith-Ryan. Dr. Smith-Ryan is an associate professor in the Department of Exercise and Sports Science at the University of North Carolina, Chapel Hill, where she serves as the director of the Applied Physiology Lab. She is also an adjunct associate professor in the Department of Nutrition. Dr. Smith-Ryan is an active researcher in the fields of metabolism, leading projects funded by the National Institutes of Health and international and national industry sponsored clinical trials. Dr. Smith-Ryan has contributed to over 150 peer-reviewed manuscripts and was recognized by the FNSCA as the Nutrition Researcher of the Year in 2013 and the Young Investigator of the Year in 2015. Dr. Smith-Ryan serves as a UNC Chapel Hill liaison for the Working on Women in Science initiative. She has a passion for improving the health and quality of life of others through evidence-based research. We want to thank Dr. Smith-Ryan for joining us. Dr. Smith-Ryan, mic is yours.
Thanks, Erica, for the nice introduction. And it's so great to be here. And it's just so funny. So Erica is studying under Dr. Stout, who is also my mentor. So it's just this nice chain that we have today. And I don't know if it's good that I'm last. See people slowly dwindling off. So hopefully I can keep you guys engaged for the next 45 minutes. Thanks for having me. Big shout out to Matt and all of you that put this together. It's been a class act and it's so much work. So I'm really honored to have the opportunity to chat with all of you. And like I said, I hope I can keep you engaged. I didn't realize I had 45 minutes, so I'll go through some of these slides a little bit quickly. But I do want to say, I also know there's a lot of students on the talk, and I want to show you not only about high intensity interval training, but also how it's kind of traversed my career, how I started with high intensity interval training actually as part of my master's thesis, and then how now it's continued even with NIH federal funded projects. And I also hope to generate new research ideas, because as all of you know, it never ends. And I think these types of situations really engage and get the mind going. So let's get started here. I think high intensity interval training is a funny thing, and it's transformed. So my first project was over 12 years ago, I guess even longer than that, 15 years ago. And people didn't really know what HIIT was. You know, sometimes it can look like this. There's all sorts of, comes from the New York Times article. You know, lots of iterations of high intensity interval training, short intensive sprint interval training, short intensive interval training. So I'm going to give you kind of an overview of what I'm going to talk about on what is HIIT. So a couple things to think about. Broadly, short bursts of vigorous activity, generally over 85% of VO2 max, so it's high intensity, and then it's interspersed by periods of low rest. So this is just one example. A couple things to think about that I personally like with interval training is that it doesn't have to be super strict. Obviously, in a lab-based scenario, we often measure VO2 max and prescribe it based on there in a very controlled setting. But the nice thing is that it can be translated and, you know, you work hard and then you rest. You work hard and then you rest. And a lot of it is based on the amount of time you can spend in the higher heart rate is higher than you could if it was, you know, a continuous slow and steady. The types of interval training is infinitely variable. meaning there's all sorts of different kind of methods, modes, and I'm going to cover some of them today. And really, when you think about the large physiological adaptations, which I'll highlight, it's involved or kind of variable depending on the intensity, the duration, and number of intervals. And it matches nicely with what Dr. French even noted, is that interval training, I kind of laughed because as a previous college endurance athlete, we would do intervals all the time. But now it's this very, oh, what's HIIT, or I'm going to do HIIT or Tabata. But there is some really great growing data behind it and how you might want to use different protocols for different populations. So this is a brand new article, meta-analysis that really breaks up kind of what is HIIT versus what is sprint interval training, what is moderate intensity continuous training. And so, go check this reference out. I am going to be talking about HIIT today. So really thinking about 80 to 100% peak power output. It's a high heart rate. There's a couple of different ways you can prescribe it. A lot of the initial data that we see in this area, like repeated wind gait, some of those things all done kind of focused on short interval training or sprint interval training. And I love that. It's repeated wind gaits. But when I started in this area, to me, that wasn't really transferable. You can't go to the gym and do repeated wind gaits with a percentage of your body weight. Whereas HIIT, what we're seeing is that most people can do anything for a minute repeatedly, and you can kind of vary that intensity on your own. So to me, it's more translatable. Let's see if my video works here. So I want to show you so I'll turn off the volume and let it's sideways for some reason, but I wanted to show you an example. This is one of my former PhD students who's now a postdoc with Dr. Arnie Ferrando. But what we often do with the interval training, I think she's running at about 11 miles per hour. And we usually, depending on the population, will have someone jump on and jump off. And that short rest period or the complete rest can highly influence metabolite accumulation. So it's a big consideration if you want to allow them to rest or an active recovery. Kind of what I mentioned, just a couple other terms. That sprint interval training is the repeated wind gait, very commonly used. I don't know if I can move that. I have another example here, but at the back, I can't turn the volume off. Hopefully it'll stop. So interval training, what we'll focus on today is this. You can see how loud and encouraging they are. We're going to focus on these shorter times. I'm going to just move the slides here. Okay. So basically, the thing to think about with high intensity interval training is that it's infinitely variable. Most of the protocols that my lab has focused on and some of the data that I'll show you is either a 1 minute on, 1 minute off protocol or a 2 minute on, 1 minute off protocol. So really kind of changing that work to rest ratio, and I'll give you some of that data. The foundational concept in my mind is that HIIT training is very time efficient. And we've seen in multiple studies, not just from my group, that it rapidly improves cardiorespiratory fitness and body comp. So like I mentioned, as a former endurance athlete, that, I thought you had to train for hours a day. And even Duncan mentioned this, like the only way to lose weight is for this, hours of cardio. That's not true. And in a more realistic scenario, who has the time to do that? There's also a lot of, injuries with the high volume. So to me, HIIT is a very practical way to see changes quite quickly, which has a very translatable approach for clinical populations and for people that don't have time to exercise. So one key area that we've looked at now is, our middle-aged women who have careers and kids, and how can we implement HIIT? Done it in a lot of clinical populations as well, which I'll show you. The other key thing that, to stimulate some research ideas is when we first started in this area, I'll show you my first study, we showed that there was an increase in lean body mass, which is kind of odd, particularly when you think about more of a aerobic-based exercise. But if you can think about the implications, if I can get rapid improvements in cardiorespiratory fitness and also upregulate protein synthesis potentially, that has huge clinical benefits. And that really set the foundation for a lot of my work, which I'll show you, and that we continue to do. So here's a poll. I don't know if Erica will populate this here. I'm going to just stop. So really, as before we talk about the applications of HIIT, I'll give you a chance to look at what do you think are the primary physiological mechanisms behind why we see adaptations with HIIT?
I'm just waiting for the answers to come in. I'll give it a few more seconds and then I'll publish the results.
Well, and it looks like your answers are a bit wrong. So A should be reliance on type 1. So it looks like the question was repeated in A, no big deal. So A, the answers is reliance on type 1 muscle fibers and oxidative metabolism. And then the rest are correct.
You know what? It was put in wrong, but the audience figured it out because no one clicked it.
Okay, perfect. Okay, good. You guys are on top of it. So B and C. So really fascinating in my mind is the rapid changes in mitochondria, as well as some of these enzymatic changes. Sometimes that happen with a single session. And then one of the key pieces as we see the effect on muscle is that high intensity interval training is able to recruit larger motor units and these type 2 muscle fibers. So let's move on and look at some of that data. So just like I mentioned, the other key piece is increased muscle buffer capacity. We also see a change in metabolic fuel utilization, which I'll highlight. And the question then comes is, can HIIT be used in all populations and what would be the benefit? There's still a lot we don't know, but there is so much growing data that's built over the last, I mean, most of you probably know this. Most of you are probably doing HIIT. And if you're not, you should be, even if your goal is, maintain health. And I'll show you why. So I'll just give you a little anecdote. When I first came to UNC, I had transitioned to trying to do a more clinical group. So really probably one of the first studies of HIIT in overweight and obese individuals. And I couldn't get it through my IRB. They said it wasn't safe. And now we know much later, like it's very safe. So I wanted to show for all those students out there, two things. So when you go to do your master's and your PhD, you obviously, my biggest recommendation is find a mentor that, that you can work well with and that is, is supportive, which I was so thankful to have. And then also in an area that you find interest in. And so my PhD and master's degree worked around exercise and nutrition. But I knew I never wanted to work with just young, healthy people, which is what I primarily did. One of my first, so here, my master's thesis looked at beta alanine and high intensity interval training. These two studies came from that. And then another study that we did, you'll notice David Fukuda's name, got to study with him, looked at a pre-workout with high intensity interval training, again, in young, healthy people. And I knew when I finished my degree, I wanted to help people that maybe needed a little bit more help. And so I had all those skills as an independent researcher to, like I mentioned, go and do my first study with high intensity interval training in overweight and obese adults. So being able to have those skills to translate to what you want to do, that's the whole benefit of getting your PhD. You can then go on to build your own lab. So the highlight here I wanted to say, and what's really continued a lot of my work, which is I never thought would, is that we did this first project. We did 6 weeks of interval training, 2 minutes on, 1 minute off, and demonstrated an increase in lean body mass in young adults. It's hard to do, especially with no dietary changes. 3 weeks, we saw greater impact than 6 weeks. We see a lot of times that 6 weeks is too long. There's overtraining potentially. But this idea that you can increase lean body mass is quite exciting. This second here study, or one of the studies we did with treadmill running in a pre-workout, that also fueled some of my more recent work where we look at what do you actually and what should you actually eat prior to interval training, and how does that differ for males versus females. So this particular project, it was a blended pre-workout, but it had some protein and some creatine, some amino acids. And again, after 3 weeks, we always see an increase in VO2 max, which is difficult to do in non-HIIT, so more of aerobic training that quickly. And then we saw increases in lean body mass and decreases in percent body fat. This protocol is 2 minutes on, 1 minute off, one of the hardest protocols. It's very difficult, but very effective. So one of the things that I'll just highlight, I am obviously a huge proponent of moderate intensity exercise. It's good for the mind, the soul, it's good for the body. And I am never saying HIIT should replace that. One thing I just want to highlight is it's more about the time investment and the time it takes to see these changes. So continuous data just demonstrates that interval training will result in similar benefits of moderate intensity training just much more quickly. And so I think of the practical application. If you have someone that's unfit, we want them to feel better while exercising more quickly so that they come back. And that's where I see this application to clinical work. Yeah, sure, we could put them on moderate intensity training, but it might take 12 to 14 weeks to see the same changes. And we typically don't see changes in lean body mass. So here, some benefits specifically, this notice are a little bit shorter, 15 on, 15 off, or 4 by 4 minutes, much higher heart rate. And then when we look at the application, so I wanted to share some of the physiology behind why we see the changes, because that's really driven some of these newer projects for my lab specifically. First, that very rapid changes in VO2 max, which is driven by these mitochondrial changes. So an increase in mitochondrial density, mitochondrial oxidative capacity, which also drives changes in fat oxidation, which then over a little bit longer term could potentially support fat loss. Other things that we think about, like just as we see the impact of HIIT, one thing to think about, it decreases glycogen. We can see HIIT as an effect or potential use as a way to enhance glycogen supercompensation. So you do a HIIT bout, a glycogen depletion bout, and then you can increase carbohydrate going into, say, an event. Other things, you can see greater increases in training volume by some of these changes. So lots of potential benefit, but I think it goes back to even thinking about detraining. I see application. One thing I always kind of share is, so for example, postpartum. Like you obviously haven't been able to exercise the same. Once you are able to exercise after, you're cleared, one potential thing to do is to add some sessions of HIIT to allow for those changes to happen more quickly. So you feel better more quickly. And that has lots of clinical application. So I'm going to go through these next few slides really quickly, just to the whole idea to, not a whole idea, but one misconception with HIIT is calorie burn. And I think it's important to understand because it does drive some of these whole body changes that we're seeing. So intensity dependent fuel utilization, this is just classic physiology. But one thing I want to say is that high intensity interval training does burn more calories, but not during. It tends to be more stimulated after exercise. So this, let me just move forward on sake of time. So this actually, Dr. Jeremy Townsend, a graduate of UCF, did this project. And with the rest of the group at UCF, some of you probably on the call here, great study that really was evaluating what happens after HIIT. So they did a little bit more of a sprint interval training, the 3 repeated wind gates, versus 30 minutes of moderate intensity, and basically demonstrated that excess post-oxygen consumption is where HIIT comes to life. It's where that extra calorie burn is enhanced. And so just to put that in perspective, kind of after the 30-second wind gate, so it's a total of 1.5 minutes of work, it burned about 125 more calories than, say, moderate intensity. And that might not seem like a lot, but over time that can have a benefit and then therefore support some of these changes. Let me show you some more data as well. The other idea to think about is maybe it doesn't burn more calories. So this is looking at 24 hours after, and it compared HIIT versus an endurance versus no exercise. And really this study showed that the 24-hour energy expenditure was no different between endurance-based and HIIT. Some might think, well, okay, why would you do it then? It doesn't burn more calories. But to me, it's crazy that you can have that caloric expenditure with, a quarter of the amount of time. And I also want you to think like this is not all about weight loss and energy expenditure. This kind of idea also should drive nutrition. So I often think about, okay, if EPOC is that elevated post-exercise, well, then we really need to focus on fueling post-exercise, or what's that cumulative effect if, depending on our end goal. So energy expenditure is absolutely increased, but it's likely after, and you have to do much less volume to see that same energy expenditure. Metabolically, I wanted to throw this in here because it ties into some of what we're doing and, maybe stimulate a new idea. And there's this idea that, metabolomics, essentially, really getting into this idea of not kind of detailed substrate utilization. And this particular study did one single bout of HIIT versus moderate intensity. So it's an acute and well-trained male cyclist. And you can see 10 by 4 minutes at 80% peak power output was their exercise. And they really looked at what was the metabolomic effect? How did it influence fuel utilization? And also looked at RER. And interestingly, so it tends to upregulate, and this is consistent, upregulates TCA intermediates, so fat oxidation, non-essential fatty acids, also amino acids, specifically alanine, and those were elevated post-HIIT. And it also, upregulates protein oxidation. So a couple applications, you're probably thinking like, why in the hell do I care? But for example, I took this data and we currently are doing a project in type 1 diabetics to identify how something like HIIT could maybe influence insulin and fat oxidation in this scenario. We've also looked at it in different cancers, which could, be regulated by different chemo drugs or the application. If we can regulate some of these things more effectively with an acute bout of exercise, then what's also the long term? And then how does that obviously influence, cholesterol, a number of metabolic syndrome parameters? So to me, I think this area is very ripe in so many different populations. This is just showing some of the enzymatic differences, which is quite different. They're quite significantly different post-HIIT. And then this is an application that it's a study that we did, and I think it's not often looked at, and I want to share because it has some great applications. So just a quick overview, we looked at aerobic exercise bout versus a HIIT bout versus a high intensity resistance training, specifically in women. And we wanted to look at, the purpose was to look at what some pre-nutrient feedings that might influence some outcomes on resting energy expenditure, RER. As well as how do each of these influence energy expenditure. So a couple things to show you. So immediately post-exercise, the energy expenditure was elevated versus HIIT, which is not surprising. We were a little surprised that a high intensity resistance training wasn't elevated as much, but you can see that REE was elevated significantly at 30 and 60 minutes more than the AE, but not more than HIIT. So my takeaway here is, if you're trying to get that elevated energy expenditure, probably a combination of HIIT and HIIT, but you can see HIIT has that huge benefit kind of in the short term. And then fat oxidation. So I find this interesting too. Hopefully, from basic ex-phys that HIIT training or any high intensity training, you should be using carbohydrates for fuel. That's, intensity dependent. And you see that. So you see immediately post, we see that significant, almost, all carbohydrate use. But 30 minutes after, we actually see a drop in RER and even 60, showing that fat oxidation is upregulated, more so than I would even say there's data after an hour. So again, that kind of afterburn is what I think, Orange Theory calls it or whatever it may be, but it's very true. And again, thinking about recovery applications to this to different clinical populations is important. Okay, so another quick poll here. So if we think about, obviously, if you were listening, you can probably answer this question, but maybe think about it before you heard this. Do you think HIIT is an effective way to support increases in muscle mass? True, false shouldn't take too long. Okay. So most of you said true. Some of you said false. Before, a few years ago, I would have said no way. But the data is quite surprising. And we've been shown consistently in some other groups that it can support muscle mass increases, not just even support maintenance, but increases. So I wanted to show you some of that data because I would imagine if you're logged on today, you have an interest in strength and muscle. And HIIT could be an effective way to kind of support that. So here is an initial study from 2015 that compared resistance training versus aerobic training and HIIT. So that 10 by 1 minutes on, 1 minute off in an older group. So remember, realize that an older group, that muscle may adapt, to that a higher stimulus more rapidly, say, than a younger muscle. And this study showed acutely, so it's a one bout, that high intensity interval training increased mitochondrial kind of properties, density, and no changes in aerobic and resistance training. And then this, I think, is what's most insightful. So myofibrillar protein synthesis was significantly elevated 24 and 48 hours post HIIT, and resistance training, of course. And so this is a mechanistic way, or even support, that shows that HIIT may support muscle protein synthesis, which to me has lots of application, particularly for maybe people that don't have access to a gym or maybe clinical. And so we've taken some of this data, and actually this was happening at the same time we looked at the impact of HIIT in this overweight, obese group of kind of middle-aged men and women. Couple different protocols. So low intensity training, 2 minutes on, 1 minute off, or this is HIIT, 1 minute on, 1 minute off, and looked at lean body mass and muscle characteristics. And essentially we found that the 1 minute on, 1 minute off protocol demonstrated increases in muscle size and improvement in muscle quality. And this was after 3 weeks. So if you can think about the application, so increases in muscle size and quality can also have, potential implications for preventing things like metabolic syndrome, or, even supporting those changes. You can see that this 2 minutes on, 1 minute off also did, but this study, or after this study, we've really moved just to that 1 minute on, 1 minute off. It's much more manageable to be able to, even be done at home. This study we just published. It was from Dr. Katie Hirsch's dissertation, and we added, for the first time, one of the first groups that added a nutritional component to HIIT. And so the thought process was, is if HIIT can stimulate protein synthesis, how does it differ if it was just an amino acid, or is there, a combinatory effect if we combine HIIT and amino acid? So overweight and obese men and women, you can see that body fat, the BMI, 8 weeks of HIIT. The protocol was a little bit different. For sake of time, I'm going to kind of keep moving. But essentially, the data from this study after 8 weeks demonstrated significant increases in muscle size and improvements in muscle quality. Also demonstrated much greater effect between HIIT and EAA. And so really thinking about that combined effect of some amino acids around HIIT can further support some of these protein changes. And then this is a study, actually one of Dr. Stock's former students, who it's not out yet, but looked at really what are some of the neuromuscular changes? What are the time course changes, which hasn't been looked at yet? Like how quickly do maybe some of these neuromuscular changes happen? And so this study looked at younger men and women, 6 weeks of HIIT versus no training, and tested some of these neuromuscular changes after 3 sessions. So kind of every 1.5 weeks to get an idea. And the interesting thing is, so if you see kind of the differentiation, so HIIT demonstrated increases in muscle size and volume of the VL after 1.5 weeks of training. So I think that has, some application to specifically, different clinical populations, rehab, lots of different aspects. The one thing I will say is not been yet evaluated sex differences. Do the men and women respond differently? And that's a key question that I would ask, because that also has application. So just another study here demonstrating too that there are potential sex differences and these muscle protein synthesis changes. So there's a lot of data and growing data that does suggest that HIIT will support improvements in protein synthesis. But there may be a difference, particularly for males and females. And some of this relies too on different protein oxidation rates. And there's data that suggests that women kind of in between the HIIT bouts have greater vasodilation and greater ability to remove the metabolites. And so we may need some different protocols there. So this was a study that my group did with a collaborator in genetics to look at some of these sex differences. This was done in mice, but I wanted to highlight it. It's basically, to quickly summarize, we looked at some different genetic strains of mice, specifically males and females, but we had strains that responded paradoxically to exercise. And what I mean by that is that they would exercise and they would gain fat and lose muscle, which does happen in humans, but obviously more genetically controlled in a mouse. And we took those strains plus strains that were responded normally, and we put them on a HIIT, moderate intensity training, or no exercise. We did this in the mice. And essentially, the takeaway is that HIIT trumped all of those responses, meaning that regardless of the genetic strain, the female mice that did paradoxically respond, and the male mice, the HIIT allowed them to respond the way they should, meaning they lost fat and gained muscle, which to me, again, has huge applications for those people that are trying to lose weight and gain muscle. HIIT could be a very effective strategy. So let's look at some clinical populations. So this goes back to that idea that, while I was in grad school, we did some older adult work, but I really have this interest in helping the people that, maybe don't know how to exercise, they're doing it all wrong, they're making it harder. Particularly, our overweight and obese group and our women. And this was, one of the first studies I did at UNC. We did only 3 weeks of training, but the compliance is the highest I've ever seen. We had people come in 3 times a week. Basically, it was almost 100% compliance. There was no adverse events, meaning these overweight, obese individuals trained with me for 3 weeks, 3 times a week, no issues, and actually huge benefits. When I say huge benefits, they really enjoyed it. They saw decreases in abdominal fat. They saw decreases in percent fat and fat mass. To me, I don't think these are that huge, but we didn't change diet at all. And so the idea that we can make a very minor modification in their lifestyle and have an application like this, to me, is quite insightful. And from there, then I wanted to translate that into more of a clinical group, or again, can we do this in, let's say, a physician's clinic? So for this project, I took my work that I had done previously with nutrition, and basically we prescribed exercise and nutrition as medicine. I worked within a family medicine clinic, and we had these patients at risk for cardiovascular disease do HIIT and a meal replacement at home for 12 weeks. Compliance was a little bit harder. It was quite the interesting kind of scenario, but collectively we saw pretty big increases in VO2 max or VO2 peak. And we also saw decreases in triglycerides, fasting glucose. So again, just kind of that idea that exercise is medicine, and it doesn't have to be super complicated. But this, I think, is where we need to look more at, particularly even now we have a grant in to look at how you might translate this to different minority groups, ethnic groups that maybe, have different resources to exercise. This is another study that we did, so demonstrating that we used it in pre-bone marrow transplant patients, kind of that same at-home program. This was a collaborator that is a specialist in cancer, and demonstrated significant improvements in VO2 peak. And in this population, VO2 peak is significantly related to mortality. So the higher their VO2 max, the higher and the greater or reduced chance they have for dying from the disease. The other key thing that we saw in this study was that their transplant was much better. So those individuals that were in the HIIT group, they responded much better and were able to recover faster. So clinical group, and we've done one other study in that population. Another clinical group, so another application, I know there's a lot of PT folks around. I had a collaborator in physical therapy that has a special interest in knee osteoarthritis. And so the thought here is, if HIIT actually increases protein synthesis and can support muscle, how does that influence something like the knee joint? Those individuals that have, low mobility and can't exercise due to pain. And so I've done 2 studies in this area, looking at 6 weeks of HIIT on more of our metabolomics, and 12 weeks of HIIT more on some of these other high-level outcomes. And I will show you. So this was in the lab 2 times per week. I'll show you. Oh, my things aren't going to move, but A couple summary items is that there was significant improvements in some of the metabolomics after 6 weeks. So things like fat oxidation, amino acid oxidation, which then can, influence some of the comorbidities associated with knee osteoarthritis. We saw significant improvements in lean body mass. And also interesting, significant improvements in pain. So exercise might cause pain, so we think, but we would literally wheel some of them with a wheelchair to the bike, allow them to get on, obviously range of motion changes, and then, we saw huge benefits. Here's some of the changes. So saw increases in lean mass, leg lean mass, and decreases in total pain and function, essentially. And then a current study we were doing, again, just trying to get the wheels turning, is using HIIT in endometrial cancer. So here's some of the ideas. So HIIT has been shown to improve insulin sensitivity, going back to that kind of key changes in mitochondrial adaptation, metabolic function, and that indirectly could influence tumor growth, particularly this type of tumor in the endometrium is very similar or can be treated oftentimes with metformin. So similar to kind of a diabetic pathway. And so we are looking at this now as how does a preoperative HIIT intervention influence tumor growth and then all these physiological outcomes. So stay tuned. Okay, and then a couple applications. I'm going to go through these quickly for sake of time, but this is a review we got to put together, and I think this is a huge area that we still need more data. So we actually put this together before even our study on amino acids came out. There's some data that suggests these 3 dietary supplements, so sodium bicarbonate, nitrates, and beta-alanine, can potentially support improvements in interval training and then indirectly improve some of these outcomes: body composition, cardiorespiratory fitness, lean mass. Still questionable on caffeine and creatine, and then also the influence of like high protein versus low carb. So more data there, particularly if we're translating this, to different groups. Let's say even post rehab, I think about, the potential implications of creatine. I also think about, what are the male versus female differences when you start applying some nutrition. And then just a thought here, application I'm going to move for. You guys all, I would assume, know what concurrent training is, but I'm going to go to this last slide here. And we know that, if you do concurrent training, which means aerobic exercise and resistance training at the same time, there's usually is a loss in strength and size. Particularly lower body is more susceptible to these decreases in strength and hypertrophy if you're doing both. But interesting when you think about some of the application, the question is, can you do concurrent training? And the data, when we look at HIIT training, if you add the HIIT component versus more of our moderate intensity, the HIIT actually can help alleviate some of these decreases in lower body strength and muscle. And so the takeaway here is another aspect of HIIT is a good way to also maintain muscle size and function, even if your goal is not aerobic capacity. This is even the application too when we think about some of the weight loss or the physique competitors. HIIT is a really potentially more effective way to lose some of the body fat while also maintaining function and strength. And then a note here, there are some negative effects, I would say, of HIIT. The whole idea is that your mitochondria become really efficient and, very dense, which then if you have someone that's very fit, it can cause some potential adaptation, meaning now they're really efficient, lower caloric application or lower caloric burn for the same intensity. But there's some other ways to get around it, or you can always modify the HIIT to kind of keep those metabolic perturbations continuous. So what we don't know, what are the long-term effects? The longest term study, there are some 24-week data, but it's more in the community. So what are some long-term effects? What's too much? There's a new paper that just came out that maybe said you don't want to do more than 3 days a week of HIIT. Based on kind of the overtraining aspect. How long do the adaptations last? So if you think about traditional endurance training, how long do these, so once you stop HIIT, how long do these metabolic adaptations exist? Can you modify diet, and should that differ between males and females? And then what are the true clinical benefits? Kind of what is the lowest volume that you have to do? Could you get away with 1 day a week, let's say for an older adult or for someone in therapy? And then you guys will have these slides, but just a couple things to think about is always translation to me. Like you're not always going to have a lab and prescribe it. You can, but we've also done, like one thing I tell people is if you're going to go do HIIT, let's do 1 minute on, 1 minute off. Pick something that you can't do for 1:20. Like you want that minute to be hard, and then you rest. And you do it again, and you're going to shoot for 10 bouts, but maybe you're going to start with 5. So it doesn't have to be super complicated, but obviously for research, you want it more controlled, but it's very easily translatable to an at-home, which we've done in several scenarios. A couple other aspects there. And then quickly to wrap up, just a couple things to think about. There's rapid changes in cardiorespiratory fitness. This happens very quickly. Like I said, sometimes the data shows even after 2 weeks, and has huge clinical benefits there. There are improvements in insulin sensitivity and even glucose metabolism, which relies basically on that mitochondrial function. There's mitochondrial biogenesis and growing data to support this protein turnover and synthesis, which is great in COVID, right? You don't have to have a huge heavyweight gym, but to help maintain protein synthesis and muscle mass, this might be a good option. Men and women appear to respond potentially differently, and we're seeing that. But one thing I would say is, like I tell all women, particularly as they traverse to menopause, HIIT is one of those key things that they should be doing based on the data. And then there may be, overall some improvements in lean mass. One thing to think about is right now volume, like you don't want to do too much volume. So I would say a takeaway is 2 weeks, 6 sessions can really result in some of these changes pretty quickly. So within that, a huge thanks to my mighty lab team that's always growing, and to Matt, Stock, and all of you for sticking around and for the invite here, especially on a Friday afternoon. And I think maybe we have a couple minutes for questions, but I'm also sticking around for the open forum. And if you have any even research ideas that you want to chat through, I'm here. There's no sense of us of all doing the same thing in different labs, like combining them and really moving things forward in this area is really ripe right now. So with that, I will stop.
All right, just 1 second as we get our student back on to ask some questions. I know we have some there in the Q&A. Let me see if they can turn their camera on and.
Yeah.
Do you want me to start answering?
Sorry, Megan, it says we're not able to, but we can go ahead and just start asking you about the video if you can hear us.
Yep, we can hear you.
Okay. All right. So sorry about the technical difficulty, but phenomenal talk, obviously, and anything you've ever wanted to know about HIIT and more. So thank you so much, Dr. Smith-Ryan. We do have a couple of questions. So one person said that they're basically wondering what the duration for an entire HIIT session seems to be most impactful for aerobic capacity and lean mass changes.
It's a great question. I would say one key thing, like we've started lower volume more recently. So something like 5 bouts. So that's 5 total minutes of work, 5 minutes on, 1 minute on, 1 minute off. But generally, I would encourage like a 10-minute bout. So 1 minute on, 1 minute off, 10 times. So it's 10 minutes of total work. Tends to be pretty consistent. And you see that with even the 5 sets of 2 minutes on, 1 minute off. So about 10 minutes of total work has consistently shown those changes.
Okay, awesome. Someone else had a question. They said, for severely detrained individuals, how do you go about implementing such a vigorous exercise program such as HIIT?
Yeah, that's a lot of pushback. Like, how do you get these people that have never exercised? We do it all the time. And the best part of it is because it's based on their initial intensity. So in their initial fitness level. So if their peak wattage is 50 watts, well, then you have them at about 40 watts. And if someone is an elite athlete, it's still the same relative intensity. They're just much higher. And so it's all relative. And someone, I would say the biggest thing with the clinical groups is with, especially like, if they have an exercise, you have to teach them what it feels like for exercise to hurt. It doesn't have to hurt, but like, here's what it feels like. That breathing heavy, that sweating is actually a good thing. And so that's something to think about.
Okay. And we have another question. So this is in relation to, is there any research on HIIT training benefiting recovery in patients suffering from CVA or stroke as compared to general resistance training or aerobic exercise?
Yeah, so I definitely am not an expert in this area, but there's a lot of really good data in stroke and heart disease and even post heart attack. And there is good data that suggests, because this is a lower volume, it's based on their baseline intensity. But it still has a lot of benefit.
Okay. And then we have this one other question. So I'll try to maybe shorten this a little bit, but they're basically asking about nutrition paired with HIIT if you're trying to gain muscle and lose fat most efficiently. Maybe they're just asking about different types of carbohydrates and protein, and if you're adding that into your HIIT training.
Okay, I'll take a quick stab at this. So some of our data has shown, and other data, that you absolutely should not fast before HIIT. It actually decreases fat oxidation. And some of our data, specifically in women, shows that a bolus of protein, like a 90-calorie protein bolus, is more effective than a carbohydrate bolus. And so if our goal is fat loss, and I would say a protein dose, and then depending on what else you're doing, then you might not need a post-workout. But that pre-workout protein may increase fat oxidation and then therefore support these lean body mass changes.
All right, that's, yeah, fantastic. I think we have time for maybe one more question, if that's okay with you. And then I know everyone will be jumping over to the breakout rooms. So the question is, any research supporting HIIT with neural adaptations, like for example, in a stroke patient population, or like rehab setting for ACL rehab, something like that?
Yeah, so the study that I showed a slide on, Dr. Jake Moda, who was the PI in that, they specifically looked at the neuromuscular adaptations because it hadn't been evaluated. I think there's one other study, but stay tuned. There definitely appears to be some neural adaptations pretty quickly after a week and a half of 2 sessions per week. Definitely we need more application, and I see a huge area when you start looking at the crossover effect and when you apply nutrition on this potential rehab PT application.
Okay, that so much information in such a short period of time. Again, thank you so much. Such phenomenal questions. So at this point, everyone should have the information about choosing a breakout room where you can talk to many of the speakers today and be able to ask them some questions if we didn't have time, and maybe get to know them a little bit. So at this time, I'd like to thank everyone. Thank you, Dr. Smith-Ryan, and we'll go ahead and transition to that portion of the conference today.
See you over there.
Okay.
Thanks everyone for joining us. Again, a big thank you to all of our sponsors who made this possible for us this first year. It's been great, and we're so happy to have so many of you join us. So use the link in the chat now, and you can join us over in one of the breakout rooms of your choice. I'll put that up again in case you missed it. So you'll leave this one and go to the next Zoom where you'll be able to choose a breakout room and a topic that most aligns with what you want to talk about. Again, thank you for joining us this year, and we hope to see you guys all here again next year.